we have about 72.9 million Indians who suffer from diabetes mellitus. This diabetes mellitus is a dangerous disease, crippling disease, causing many complications in people around the world. In India, this 72.9 million, according to International Diabetic Federation, have type 2 diabetes, which is caused by 1, insulin resistance, and 2, by pancreas losing its ability to produce insulin. These are the 2 factors that cause type 2 diabetes. But what can you do to prevent diabetic complications? Because many diabetics, as time you know, they have complications rising from loss of vision, cardiac arrest, amputation, kidney failure, and other things, sores, diabetic sores on the legs and other things like that, difficulty walking because of a peripheral neuropathy. What are you going to do? Because diabetes is not a disability. You have a diabetes doesn't mean that you will die from it. You have a diabetes doesn't mean that you will be disabled, you will be amputated. There are things you are going to do, there are things a doctor will do, but much of the effort lies on you, the sufferer. The things in this particular video, we are going to look at what you are going to do to prevent diabetes complications. It will not happen to you. Those things can be summarized into 2. What you can do and what a doctor can do. Let us look briefly at what you can do yourself. Those things you can do can be summarized into 3. 1, watch your weight. 2, watch your diet. And 3, keep moving. Do you know your body weight? Are you overweight? Calculate your body mass index. Do you know how to calculate your body mass index? It's explained in the video. If your body mass index is above 25, you are overweight. And when you are overweight, you are at the risk of developing diabetes, type 2 diabetes. It's a condition that predisposes you, that makes you to be liable to suffer from diabetes. Being overweight is very important. You have to know your weight, know your body mass index, and then adjust your lifestyle accordingly. The number 2 is watch your diet. What do you eat often? Is your diet fully highly processed food? Do you eat enough fruit and vegetables and fiber? That is important. Your diet matters a lot. You have to watch your weight, as we have said, watch your diet, and then keep moving. Keep moving means having exercise. Do you live a sedentary lifestyle because of the type of work you do? It's not your fault. You must walk. But if you are not such that walks regularly because of the work you do, make out time for exercise. It's a must. Exercise helps your body to burn calories. It also helps to reduce insulin resistance. So these are the things you are going to do yourself. Now we're going to look at what the doctor can do. In this video, we're going to analyze about 9 strategies, 9 checks a doctor will be checking regularly on you to avoid those complications. Watch this video to the very end. Understand those things yourself so that you will be you will be no delay in making those regular checks with your healthcare provider or your doctor so that you will remain fit. Despite having diabetes, you will live normal lives or close to normal lives. Do what you are supposed to do as a human being, because diabetes is not a disability. Watch this video very end, you are going to see all those things. And don't forget to subscribe to my channel. I have many videos on healthy living, many videos on diabetes, many videos on home remedies. What you are going to do yourself to handle some certain situations and take adequate, correct healthcare decisions so that you can remain healthy. Let us now jump proper into this discussion of what your healthcare provider can do so that you will be fit, you will avoid diabetic complications that can lead to death or cripple somebody. Let's go to that, jump into it. The important checks a healthcare provider can do regularly We had summarized into 9. We have 9 checks a healthcare provider supposed to check on you from time to time, so as to foresee development of certain situations that can lead to complications if not handled on time. Number 1 is HbA1c, hemoglobin A1c. This is a blood test that measures your average blood glucose level over the past 2 to 3 months. A high A1c is a sign of frequent high blood glucose, high sugar in your body, which puts you at risk for complications, vision loss, and even leg amputation. So when they check you, the number, they will not like your number to be higher. And normally they normally use 7. 7% is often the target number. They will not like their number. At times, a doctor can allow you to have a hemoglobin A1c to be 6.5 or slightly above 7 based on your individual needs. But this hemoglobin A1c is a proper test to see if you have frequent cases of high rise of sugar, which you might not know that have occurred in the past 3 months. So it is a test that can detect this trend, and an effort to be made by a healthcare provider to correct the potential anomaly. At times, it is done every 6 months if the last time they check you was in a goal range. But if the last time they check you, it was not within the goal range, hemoglobin A1c can be checked every 3 months. So it's a very important check. The number 2 of what a healthcare provider can do is to check your albumin to creatinine ratio, ACR. This one is a urine test to see the presence of albumin in your urine. Albumin is a type of protein. A presence of it in the urine shows that you have a sign of kidney damage. And it's very important because diabetes leads to kidney damage, kidney failure. But not in case of everybody, but most diabetes sufferers have a decreased kidney function with the passage of time. So when the doctor knows this, he can now know how to manage your blood sugar and then blood pressure and slow down the progression of a kidney disease. If that shows is there, and doctor can slow down the progression of such conditions. Normally, the unit of measure of this ACR is normally 30 milligram per gram of urine creatinine. So it should have to be less than that 30 gram. It has to be less. And how often? At times, it's normally done once a year if you have type 2 diabetes. Or if you have type 1 diabetes for at least for 5 years, it has to be done once a year, annually. But if they test you and discover that you have sign of kidney disease, they will do it as frequently as doctor thinks fit. It is a must. He must be checking it to know, not when the kidney has failed. You start to cry. But those things need to be done so as to forestall possible kidney failure. And then adequate measures will be taken by your doctor to prevent that. The number 3 is ankle brachial index. Ankle brachial index. These things we are talking, these headings will appear on the screen. So you can copy them and then make research on them yourself. So ankle brachial index is a blood pressure reading at your ankle. And then they use the result, compare it with your blood pressure reading at your brachial artery, at your arm, and check the difference. Because if they check the difference, they will now know whether you are developing a condition called peripheral artery disease, PAD. This peripheral artery disease can cause leg pain, weakness, and numbness, especially when walking or doing exercise involving the legs. Some individuals who have diabetes, you see them walking with difficulty because as they want to walk, they experience numbness. They experience the pain, difficulties when they want to use their legs to walk. In that case, the doctor has to check of this ankle brachial index, whether you have peripheral artery disease. This peripheral artery disease, when it exists, it means that blood is not flowing properly down to your legs. You have a clogged artery. The blood flowing to the legs has been impeded somewhere. And that is what we dispose one to sores on the legs, which may be difficult to heal. And at times it might lead to amputation. So that is why ankle brachial index check is necessary for a diabetic so as to avoid complications. Then the fourth one a doctor has to check is a blood pressure. You have to monitor your blood pressure from time to time. It's a requirement because because a diabetes have a risk of high blood pressure, and it increases the risk of heart disease, stroke, vision loss, and kidney disease. So once you are diabetic, it's a must that we check your blood pressure from time to time to see if it is within the goal range. So a goal range of diabetics is that it has to be below 140/90. It has to be below 140/90. If you are normal, you are not within the risk group. A risk group is somebody that is overweight. If you are not overweight, you don't have a heart problem, you don't smoke, a BP of 140/90 can be okay. Under, I'm not saying it's okay, but it's under, does not exceed 140/90. But if you have any of those conditions, it has to be below, it has to at least, will not exceed 130/80 millimeter mercury. So it has to be checked adequately, because you might be having BP 150, 160, you don't know. You're walking around. And that the pressure will increase, pressure in your eyes, pressure in your kidneys, who are already weakened by sugar. And very soon one start having complications. That is why a check is necessary. Should be done regularly. The number 5 of what a doctor can check on you is bone mineral density. Bone mineral density. This is a scan that helps to estimate the density of your bones, usually taken at the hip or at the spine. What they do here is to check the bone density to see how likely they are to break. Well, you need it if you have type 1 or type 2 diabetes and the person has at higher risk of fractures or osteoporosis. Most times they do this in women over 50 years of age, or those who have developed menopause, and even men over 50 who are at the risk of developing osteoporosis or fracture. So they now check bone mineral density, and now adequate measures will be taken before you start having problem of fractures and breaking of legs, arthritis, many things, weak bones, weak joints, before those things start to cripple the person. That is why they do those checks adequately on diabetic sufferers. The number 6 of what can be done from time to time is body mass index. Body mass index is a measure of your body fat based on your height. Why is it important? It's because body mass index indicates whether you are whether you have a healthy weight, whether you are overweight, whether you are obese. Those things are very, very important. Once you have overweight, even if currently you don't have diabetes, but this year overweight, you are likely going to have diabetes. That's one thing with overweight. People might think that being overweight is evidence of good living, that they're enjoying. That's why they're overweight, they have money, they're eating everything. No. If you're overweight, you are cutting your life short. Your body mass index is not supposed to be over 25. Then how do you calculate your body mass index, as I said at the beginning? What you do is, this one, you can do it yourself. You can calculate your body weight mass index yourself. How can you do that? Measure your height in meters, not in inches or feet. Measure your height in meters. Your height can be 1.5 meters, 1.7 meters, 1.75 meters, 1.85 meters, and so on. Get somebody who knows how to read measuring tape, your neighbor, and measure your height in meters and write it somewhere. get a kilo, a bathroom scale you use to measure your weight. A scale, and measure your weight in kilogram. Your weight has to be in kilogram, and your height has to be in meters. Then square that thing you measure, your height measurement, square it. Assuming that your height is 1.7 meters. What you do is 1.7 meters times 1.7 meters. You write the result. That result you get, use it to divide that your weight in kilogram. If you do that, the answer you get, if the answer you get is above 25, then you are overweight. Your weight should be between 18 and 25. Your weight should not be above 25. If your weight is 30, if that your result, the answer you get is 30 and above, you are obesity. And those conditions are what will dispose you to diabetes. So once you discover you are obese or you are overweight, start working, doing something. Consider it as a health urgency, because it will put you into problem. That is why you have to know your body mass index. Now, the seventh factor that has to be checked regularly so as to avoid diabetic complications is cholesterol and triglycerides. What is it? This involves a series of blood tests known as lipid panel that measures your cholesterol. Cholesterol is a fat-like substance in your blood, while triglycerides are blood fats that circulate in your bloodstream. We have HDL, LDL, total cholesterol, and triglycerides. Doctors will check all these things and know their presence in your body, because they are the things that are offenders. LDL offenders, they are what blocks arteries. They block arteries so that blood will not flow. And any organ that they have occluded arteries that are supplying them blood, the organ will suffer. Most of these complications are caused by this cholesterol. So that is why doctors do checks to find out whether you are within the risk range of having any complications arising from this. So it can lead to cardiovascular disease, it can lead to retinopathy, it can lead to stroke, it can cause leg problems, amputations, and others, because it will stop blood flow to a particular organ, which will now start having problems. American Diabetic Association recommends of a statin therapy. There are drugs to call statins, which a doctor can give you if you have problem of cholesterol. It's normally the drug they use to reduce cholesterol. They are called statins. There are many, it has many variants, but your doctor will know which one is suitable for you if you need those medications, so as to reduce high cholesterol in your system. The number 8 is dilated eye exam. In this case, a doctor, usually optometrist or ophthalmologist, will examine your eye to see if there are signs of slow eye damage, like a diabetic retinopathy and glaucoma or cataract. It's not when those things happen, become advanced. At times, you may notice vision loss. You may notice some discomfort in your eyes. You may, it's not that when you see entire vision loss, but you see slight interruption. You don't have acute vision, or you have some kind of slight something in your eyes. You rush immediately to the doctor, a qualified doctor, optometrist, ophthalmologist, who will now examine your eyes thoroughly to see the signs, whether there are any signs of those problems. And if they exist, he knows what to do so as to correct the problem. And that's how you check yourself adequately. Some people wait until condition becomes worse, or they will not take adequate precaution, or they will not take corrective measure. They use try and error method until the thing becomes too worse for them. That's why adequate care is very, very important if you are to be free from these conditions. Remember to subscribe to my channel on this video so as to be notified, because I have many videos on many home remedies, on diabetes and other conditions. Subscribe to my channel to have access to these videos, and click the bell icon so that I will be notified when I drop my next video. And that will enable you to have accurate, because we rely on authentic sources. What we have is, what we give you in this channel is authentic, what you can rely upon to make adequate decisions with your healthcare provider. Please don't subscribe, don't forget. It is very important to stay with us as we continue to give you what you need so as to remain healthy despite its challenging healthcare. Then the number 9 is estimated glomerular filtration rate, EGFR. This is an estimate of how well your kidney is functioning. That is what this estimate is. This is important because with diabetes, one have increased rate of kidney disease. Often once a year, if you have type 2 diabetes or have had type 1 diabetes before, within the last 5 years, your doctor will check whether your kidney has been impacted, whether your kidney has been affected, whether your kidney has been touched, whether your kidney has been to some extent weakened by this condition. That is what the test will indicate. And then he will now take adequate precautions. He tell you what you're going to do, so as not when your kidney has totally failed, and then you'll start to run around. This test complements albumin creatinine ratio we mentioned earlier. This one complements that test towards having adequate assessment of your kidney function. So these are important health checks for people with diabetes. This will identify the presence of conditions that can lead to diabetic complications, like amputations, like loss of vision, kidney failure, heart failure, stroke, or even death. One can live with diabetes and live with it for many years. Somehow live with diabetes for 20, 25 years. And we don't even know, say, they have diabetes, because it's properly handled, well managed. That is why adequate care, that's why we took time to bring these things to you, so that you will be informed and you take adequate decision, so that you care for yourself, you'll be alive, enjoy life, and care for your loved ones.